Ever wondered how people with developmental disabilities are diagnosed? If you know anyone who has been diagnosed with autism, traumatic brain injuries, or ADHD, the Vineland Adaptive Behavioral Scales may have been used in their diagnosis.
The origins of the Vineland Adaptive Behavior Scales, 3rd edition, which is an individually administered measure of adaptive behavior, stems from the Vineland Social Maturity Scale, which was originally published in 1935 by Edgar A. Dole. The Vineland 3 is used as a diagnostic tool to help classify intellectual and developmental disabilities for individuals from birth to 90 or more years of age. The instrument is divided into the evolution of 3 domains of adaptive behavior, including communication, daily living skills, and socialization. These correspond to the 3 broad domains of adaptive functioning specified by the American Association on Intellectual and Developmental Disabilities and by DSM-5. It also includes optional motor skills and maladaptive behavior domains for situations in which these areas are of concern. The Vineland 3 offers 3 types of forms: the standard interview form, the parent or caregiver form for use in assessing children, and the teacher form for evaluating individuals who are enrolled in school. The time needed to administer this assessment varies depending on what forms are being used, age of the examinee, and whether the optional motor skills and/or maladaptive behavior domains are included. It can take up 10 to 45 minutes for administration, depending on which assessment is being used. Since the Vineland 3 is a Level B measure, it can be administered and interpreted by individuals with a master's degree in psychology, education, or even social work, as well as individuals with a degree or license to practice in the healthcare fields such as occupational therapy, speech therapy, or counseling.
The Vineland was standardized using an American sample of almost 4,000 individuals of all ages. The sample was stratified according to several demographic variables, which are based on the 2001 census statistics. Researchers also controlled for community size and special education program placement.
Let's discuss the strengths of this instrument. Vineland test scores are useful for a variety of purposes, including diagnosis, qualification for special programs, progress reporting, and treatment planning.
The Vineland demonstrates strong reliability and validity, meaning that the measure is both consistent and accurate. The Vineland also demonstrates strong inter-interviewer reliability, meaning that the scores do not change depending on the interviewer. The Vineland also exhibits strong inter-rater reliability, which measures the degree to which scores from different respondents about the same individual are consistent.
In evaluating children with autism spectrum disorder, research found that the Vineland accurately predicted differences between communication, socialization, and daily living skills, which speaks to the validity of the instrument. The instrument has also been useful in understanding the associations between adaptive behavior and parenting stress, which can be helpful in shaping treatment programs.
Megan Hussey, a professional who has extensive experience administering the Vineland, spoke to us about her perspectives on this instrument's strengths. Megan shared that the Vineland aids in the diagnostic process, as it provides insights from parents and caregivers who know the child best. The Vineland captures a holistic view of the examinee's behavior in their home environment. While the Vineland does exhibit many strengths, there are also several weaknesses and limitations to be aware of, including cultural limitations. For example, Alaska Natives, Asians, Pacific Islanders, and Native Americans were all grouped into the same ethnic category during the instrument standardization. This category, labeled as Other, only accounted for 6% of the norming sample. This standardization sample lacks inclusivity, as othering these ethnic groups erases their unique cultural identity and linguistic diversity. This instrument also displays linguistic limitations. While the Vineland is primarily available in English, a Spanish version of the survey interview form, report to parents, and report to caregivers is available. As the Vineland is only officially available in these 2 languages, this significantly limits the inclusivity of the instrument. Megan also shared her perspectives on the limitations of the Vineland. She explained that assessments that are normed off of Western populations can be, quote, very tone-deaf when it comes to culture. She shared that some Spanish-speaking or bilingual children can incorrectly be diagnosed as having a deficit due to the lack of linguistic and cultural awarenesses of most Western psychological assessments.
COVID-19 brought with it some threats to the validity of the instruments, since standardized assessments were not normed for use with telehealth, nor with examiners and examinees wearing personal protective equipment. Due to these factors, the examinee might have felt uncomfortable using a mask and behave differently because of it, making it difficult for the examinee and the examiner to understand one another, which could have impacted the assessment results. However, that doesn't mean we shouldn't continue doing Vineland assessments through telehealth when necessary, but we do need to learn how to make necessary modifications to move forward. To overcome some of these challenges, Dr. Soliner of Pearson Assessment US encourages administrators to use their clinical judgment as to whether or not the results are valid or were swayed somehow by a pandemic-related factor. This is why it is important for the examiner to indicate in their notes when the assessment was administered, with both the examiner and client wearing face masks. It is important for parents to witness the entire assessment and to corroborate that the child's behavior during assessment was consistent with their everyday behavior.
There are opportunities to improve the relevance of the Vineland to different cultural groups. This could be accomplished through routine re-standardization of the instrument following every census in order to fully and accurately capture the diversity of the American population. This could reduce the potential cultural bias of the instrument and would allow for the measurement of unique characteristics and linguistic variations. Furthermore, translating the instrument into additional languages would improve the validity of the instrument when used with more diverse populations. It can aid in identifying many different developmental disabilities. In order for this tool to be more inclusive, it should be modified to account for cultural and linguistic diversity to reach more people in different communities.